The following podcast is a deep, shallow dive production.
And you're going to love it.
Okay, let's go.
All right, so it's not every day I get to sit down with a CEO. So this is actually a big treat for me. And listen, everybody, we've got a really great episode today. And we've got Marcus Kruk here, who is the CEO, founder, and just an all-around good guy with Zippix nicotine toothpicks. And I think what you're going to really enjoy about today is, we're going to give you a real deep dive into what it's like starting a company from scratch and really building it into something that you're passionate about, that's meaningful, and quite frankly, learning all the lessons along the way. So how you doing, man? Welcome.
I'm good, buddy. Thank you. I'm excited to be here. This is going to be fun.
This is going to be great. So, all right, listen, let's start at the beginning. I really want to start with the origin story. What was the light bulb moment that sparked the idea for Zippix nicotine toothpicks?
It's probably different than most products that start. This product was created and developed really out of necessity. In the early 90s, I was fortunate to come out of school and go to work for a respiratory compounding pharmacy. And we serviced respiratory patients all over the country, primarily COPD, emphysema, Medicare age type patients. And Medicare had just created an allowable for respiratory medication that was all unit dosed, which is important because a lot of these patients were overdosing, they were underdosing. There were a lot of cross-contamination. They would mix their medications up at the kitchen table, leave the dropper, room for lung infection. So whenever Medicare did this, pharmacies such as a compounding pharmacy had an opportunity to kind of jump into play and start helping these patients. And I was fortunate to start that, which was kind of unique because I, as a child, was a severe asthmatic. I remember on both of my grandparents' death certificate, cause of death was cigarette smoking. So I was really excited, real passionate to be this. And I was in a sales capacity. So I traveled the country working with home oxygen companies, medical equipment companies, and they would send us their patients for us to take care of. Well, one of the requirements that Medicare had is that they wanted us to reach out to these patients every month before we shipped their medication to them. It's a compliancy component. And in doing that, I took it kind of a step further. I really wanted to know what was going on with our patients. How could we help our patients, not just from a pharmacy component, but even to support them with the medical equipment suppliers out in the field. Well, in doing this, it was brand new. So we were all learning. I had some folks on the phone making the phone calls. I would get on the phone, I would make the phone calls, and I would talk to these patients, and they were precious. But realizing that just about every single one of them, and of course at this time, these patients were in their, 60s, 70s, 80s, and this was in the 90s. So this was quite a while back. But they were all smoking. And they had not stopped smoking because really there wasn't a lot of good alternatives for them to find an option, at least an educated option. So on top of all that, we had a group of pulmonologists in Birmingham, Alabama, that reached out to me, and he said, Marcus, I know you guys do a lot of custom medications. You do a lot of mixing. We would mix a bronchodilator with the mucolytic and a steroid, which is kind of unique at the time. And they said, can you help us with our patients? We've got patients that are smoking through their trach. They're blowing themselves up with oxygen.
Wow.
And one of the things during that phone call that struck me is when I was on the phone with a lot of our patients, some of them had told me they actually used toothpicks to help them stop smoking. And so that kind of was like, that was the light bulb moment. It kind of popped off in my head. And I had some incredible compounding pharmacists. I'm not a pharmacist. I'm just business.
Yeah.
And worked with them. And we came up with some good formulas. In the beginning, it tasted like nicotine on a stick. It really wasn't that appealing. But, over time, we developed how to flavor it. The old little nursery rhyme song, a spoonful of sugar helps the medicine go down. So we created some flavors to help our patients, and we got a lot of feedback from them. But so out of necessity, really, in the request of our physicians, we came up with a product that really satisfied that niche. And we would talk to them when we'd make our monthly compliance calls and, let them know about the product, which didn't have a product name. It really wasn't a product per se. It was just part of a service that we offer to our patients just to help our patients out. And it was that way for decades, right? That's all that it was. But it worked, and it took care of the desire. And if the patient had any desire at all to stop smoking, in a lot of cases, it's their grandchildren. They wanted to spend more time with their grandchildren, or they had lost a spouse due to cigarette smoking, and they wanted to spend the last couple of their years of their life, in a healthier capacity. And that's really how it started. And so this has been an evolution from the get-go of so many of these products now I'm sure are created in a couple guys in a bar saying, hey, let's do this type of thing.
Yeah.
But with us, it was birthed out of necessity for just for the love and care of our patients.
I mean, if you ever watch Shark Tank or any of those shows, they always say the best way to create something is something that you need. So what is the need in the marketplace, and then create out of that. So are you saying people were using toothpicks that were not flavored just to sort of have that, I guess, to simulate the concept of having a cigarette, kind of like an oral fixation situation?
Freud called it a long time ago, oral gratification. That hand to mouth is such a big component. You got nail biters. I'm a fingernail biter still to this day. I can't stop it, but so many people, they'll chew on straws. And there was a recent study done, I think Harvard did it, that looked at people that have almost compulsive to chew on things, and especially wood. They chew on pencils. They love to have the ability to kind of bite down, sink their teeth into it. And the supply. And if you think about really a lot of habits that we have when it comes to the love of the stomach, you got a bag of chips, you're constantly doing this. That habit that you've created over the years has formed in your brain. And with Zippix at the time, then again, it wasn't called Zippix. It was just our product. I really tried to emulate what somebody does when they're, let's say, working in a plant. They get their 2 15-minute smoke breaks. They've got to run outside and go puff the cigarette real quick. How do they get it out of the pack? They tap it, they'll do this, a lot of just habits. And even the packaging really was kind of constructed and designed all around those habits to really help people overcome that, that desire. We pack our toothpicks slightly moist, going back to the old, hey, I got a 15-minute smoke break. Well, when you inhale, you're going to bring that into your lungs and you're going to feel it right away. But when you're going to absorb something sublingually, it's going to take you a little while to absorb it. But when it's moist, it acts faster. And so I try to do everything possible to really make it like somebody that's, trying to stop that hand to mouth, that oral gratification, quick acting with a moist toothpick. And it's worked. We've helped thousands and thousands of people all over the country, overcome, the desire to bring that smoke into their lungs. That's really, in the first decade of doing it, really, I never even had the idea to take the product to market. It was just a product that we're going to service our patients, and that was it. But when we saw the results and we saw the success and saw the love that our patients had for it, then it turned into something over years to get it out to everybody.
Got it. So was there a specific moment or a particular moment where all of a sudden you're like, wait a minute, I think we have a business on our hands? Because it sounds like you guys really started this out as, a real way to benefit your patients, which I think is incredible. And by the way, the customer service that you provided to patients, decades ago, funny thing is, I think you're still providing that customer service to this day, which probably puts you in the top 1% of companies, because man, customer service has just gone down in this country. But talk to us about sort of that moment of transition from, hey, this is a nice added benefit, to, wow, I think we have a business on our hands.
Yeah. Well, it's such a long story. It really starts from, the early 90s to, goodness gracious, about, I guess, 2018 is really when it really kind of took off. And that was through one channel. That was the online channel. Prior to that, I had the idea to take it to retail, working through distributors, going out to the tried to originally go to pharmacies, which it really wasn't received well because we're classified as a tobacco product. So when you're looking at pharmacies, they either put you in the cigarette section, or they've got some of the other Nicorette products that they put in the pharmacy section. And so we were kind of like, where do we belong? So the challenge over the years, and that was not an exciting time, taking it to retail through the distributors. Coming from the pharmacy world, knowing how that world works, it was completely different than going into the stores through distributors. And so that was a period of time that was not the most exciting period of time. I had to, downsize my house a couple times and took it on the chin. But in 2018, when we took it online, we were kind of fortunate. we did some Facebook paid ads. And actually, we're a restricted product on Facebook. We're a restricted product in so many places. It's really difficult to market a nicotine product today. Even, it's the policies that not necessarily are controlled by the government, but just a lot of companies decide not to promote nicotine products. But when we took it out online, and I have a business partner, and we'll talk a little bit about him, but I really didn't know anything about online sales, and
Yeah.
we were fortunate to get with some folks that have helped us, build a site, help us kind of get it out there, and started down that Facebook path, and it started to grow. It started to take off. And one of the biggest parts in how we grow today is really word of mouth. We spend a lot of money to advertise, but when you look at it, you break down the percentages of growth through our podcast advertising, through our social advertising. Word of mouth is still such a significant part of our growth. But to see it, to grow, and just like any business, you're obviously looking at the sales, and you're looking at the numbers, you're looking at your margins, you're looking at every component. But it never disappointed us. It continued to grow and grow and grow. And so that's when, about a year into it, about 2019, it was like, this is working.
Wow.
This is taking off, and it it started to flourish after that. And timing was good for us, though. COVID, there was a lot of bad press about vaping, and so timing is literally everything. When I first started this thing, and if I wanted to take it online, or even in the early 2000s, it wouldn't have worked. So at the time we took it was perfect for it to take off. But there were some outside influences that were driven by what was going on in the world. I think that also contributed to our success. For
Yeah.
sure.
Okay. That is interesting, and you're dead on with timing. I think in business, timing is absolutely everything. And so you probably launched it, started seeing success on Facebook, and then we got into the COVID period where people were at home, and then also people were buying everything online. And so having set up like that. What about on Amazon? Is that someplace that is applicable to you guys, or is that been a
No, it's restricted. Yeah.
okay?
And even Facebook, we actually were able to go on, do paid ads with Facebook for, I think, a couple years. And then that pipeline shut off. They discovered that we were, not that we had full disclosure, but they completely stopped it. Now that was a little bit of a difficult challenge, because we knew that worked, and then we had to go out there and find another.
Yeah.
And everything that we tried, print, radio, just fell completely flat. you
Yeah.
know
Yeah.
I did some magazines, even we did programmatic advertising. The product needs a story. It needs not a long story, but it
Right.
needs a story, a toothpick. Even today we'll have customers go, is this a wooden toothpick?
Right. Right.
Everybody thinks something's just made and popped out of a plastic mold, and then it's automatically sucked into a package, and then poof, it shows up at your house. But no, it's an actual wooden toothpick, which is perfect because of toothpicks porous. We use birch wood, and the process too, in which I infuse these toothpicks, it's a difficult process, and it took me years to
Yeah.
develop. And there's a certain there's amount of time that we've got to infuse the toothpicks and spin them, and there's a certain temperature of the formula. There's a certain amount of pressure that we pull when we infuse them under pressure, and it took years to be able to figure that out. But I tell you what, not only do we have an incredible customer service, but our product is just, if you've ever tried like a Nicorette lozenge or a Nicorette piece of gum, you'll chew on it, and then that nasty nicotine kind of bites you. Well, I'm able to infuse these toothpicks completely through, so it's an even infusion of flavor, sweetener, and nicotine. So you never get that nasty, bitter taste. It always tastes very smooth, very mild, and very flavorful. It's got a nice, robust flavor.
No,
And that's
that's
what people
great.
love. Yeah.
That is what people love. And I read through all the reviews, and I will tell you what attracted me to your business initially was, I really felt like these guys are somebody, yes, they're creating a product. Yes, that product does contain nicotine, but you're really almost like a gateway to stopping nicotine. You're a gateway from stopping smoking, transitioning to something. I think the things you're talking about the hand to mouth, and really the need to have something. I mean, I see people chewing on toothpicks every day, And the funny thing is now I'm wondering, man, are they chewing on a Zippix or are they just chewing on a toothpick? I'll start to have to ask them that question. But I think you've really touched in a category that there's a need for the category, there's a need for the product. And again, unlike, other things like Nicorette or nicotine gum or things like that, I really feel like you guys are leading people down the line of, heck, potentially not even using Zippix at some point. Maybe they get to the point where they don't need that. And I really think that's commendable, especially in this category and in this product where the perception of it, as soon as you hear nicotine, people maybe put up some defenses, but they need to get to know, what the purpose of this is a little bit more.
You're right. We have Zip Energy, which is a caffeine and vitamin B12 infused toothpick. It's a light dose of caffeine. It's less than a Coca-Cola. But, what we try to do is create a step down product, going back to our roots as a pharmacy developed, product that if we actively promote it to all of our customers that, hey, if you're looking for an alternative, because that hand to mouth habit that's been developed for a long time with a lot of folks, that's something that even if they got rid of the nicotine and substituted it for the caffeine B12, it's an option that we created for our customer base.
Oh,
But,
great.
but you said nicotine does get a bad rap. Like I said, both my grandparents passed away for cigarette smoking, and I always contribute that to nicotine. But in a lot of cases, it's really a lot of the studies out there, and I'm not going to go down that study rabbit hole. But nicotine by itself is not necessarily the culprit. It's a lot of the other factors when you're bringing things into your lungs. A lot of other carcinogenics, oils. Other things that can, and I was watching a cardiologist the other day online, and he made a comment. He said, I've never seen anybody die from smoking one cigarette, but I have seen people die doing one vape. And so we don't really know, and that was the words that he used, that we don't really know what the future holds. Just like with me in the 90s, being in a fully respiratory medication pharmacy, we knew what cigarette smoking did to these people 20, 30 years ago.
Right.
They're now at a point, they're now a customer or a patient of mine in my pharmacy that they can't breathe. They're COPD. There's no cure for COPD. It's a horrible, slow death.
Yeah.
And it breaks my heart, and I'm still deeply connected to, and I slip up and call, this is not a pharmacy today. We started off as a pharmacy. We're not, but I slip up all the time and call our customers patients. It's just ingrained in me, but we care about them. And you talked about customer service. We take care of our people. I mean, we just really focus on that. That's the number one focus, is taking care of our customers and making a great product. Quality control is key. Every toothpick that goes out of here, there's a testing done on every batch just to make sure that it stands up to the quality and the consistency that we've been offering to our customers, not our patients.
Absolutely. I'm glad you brought up the nicotine because, to be honest with you, there are many cardiologists coming out now talking about the benefits of nicotine. This isn't something we're going to talk about today, but, the concept of long COVID and the folks that are suffering from long COVID, there are now clinical trials being done leveraging nicotine to help cure their long COVID. And it's probably the only thing that seems to be working. So I think you're dead on in, when you isolate nicotine, knowing that that's probably not the cause, but all the other carcinogens and all the other things that you're taking that go across the lungs, it's no different than our food supply right now.
Right.
Is it the potato chip, or is it all the preservatives and all the processing that went into the potato chip that's causing the increase in trans fats and the increase in all that stuff? So I think that, hopefully we'll start to really take a look at, quite frankly, what the benefits of nicotine, if used properly, can be, because I'm sure they're there. Talk to me about, one of the things of being an entrepreneur is just that personal and professional balance. So it sounds like you were on the corporate side, you were in a business. What was it that made you want to take that leap? Because that's a scary leap. And a lot of people, everyone wants to be an entrepreneur, but do you have what it takes to really, take that leap? So talk to us about that.
Yeah, when this question does come up, either from especially my children's friends or people
Yeah.
that know me, I always tell them, go ahead and start. The sooner you start, the better, because you're going to fail. You're going to
Yeah.
fail so many times, and then eventually you're going to get callous to it. But with me, the experience that I've gained, if I look at where I am today and what I'm doing, I was created for this, as an asthmatic, as seeing what happened to my family members, and getting into the field. I had a background in sales and in business, and just applying that over time and over the decades to get to this point, and not to be impatient. To go out there, expect to fail, and not to be impatient, and just keep doing your best every single day. And that's exactly what's happened with Zippix. Zippix has gone through so many valleys and not as many successes, but the opportunities, the times that I've wanted to quit were huge, from the time that I took every penny that I had, and I put it into it and went after the retail. And one of the first chains I ever got was Circle K. I went into Circle K and met with them and presented it to them. And they were like, hey, let's do it. I gave them pricing and everything. And then they said, oh, by the way, here's your distributor, and not knowing that there was even such a thing as a distributor and how that even worked. And then the price that I gave them, really, it's not the price. After after the distributor takes their big piece, it's like, that was a challenge. And then that actually happened at around the time that the BP oil spill hit. I don't know if you remember that. It affected the Gulf of Mexico. And then all the Circle K chain that I had was the Gulf Coast Circle Ks. And one of the things that happened is they pulled most of their, other than the milk and bread and gas and beer, they pulled a lot of products, and mine was one of them. And so that really hit me straight on the chin. But the failures, and then after that, coming from and starting in a healthcare type environment, I really wanted to bring the product to healthcare entities. There's a lot of companies out there. They do kind of dock in the box. They actually affiliate themselves with large plants, in working with some of them. And I've worked with some of them, but you're always kind of looked down on as a tobacco product and not an FDA approved pharmaceutical product. And so those challenges were difficult. I knew what we did. I knew that we've helped people. I knew that this product would work. And when you bring that kind of information and knowledge to people you want to work with, and they kind of look at you like, you're just a gas station cigarette. It was difficult to deal with, and especially when you've got it all on the line and you're going for it every single day. It was difficult to be able to deal with that. But you just persevere. You just keep moving forward. You find that customer that'll work for you. And like you said, we were fortunate to find it online, that the message was at a great time, that people needed to hear it. And so, going back to timing, but without that persistency, I continue to work on the product. I continue to improve the product constantly, trying to get it to a point where it was the best that it could possibly be. And that, those times when I wasn't being successful in selling and moving the product, I was focused on making the best product. And now that obviously has paid off for me, putting all that time and work in. But, it's hard doing what we do, finding a place to market, even in the infusion process of the toothpick, the length that it takes. But, I found that when you do hard things, it's a lot of people don't follow you. When you do hard things, they like taking the easier paths.
Absolutely. And you know what? It's interesting to hear you talking about the continual improvement of the product, because you hear that a lot on the technology side these days. Obviously, especially with all the AI that's coming out, companies are pivoting. They're pivoting to this, they're pivoting to that. When it comes to traditional consumer products, which you fall under a traditional consumer product, even though your distribution platform is through the new age of e-commerce, let's say, it's actually very interesting to hear the continual improvement of the product that you're doing, because a lot of companies probably say, okay, we're good on the product, and they rest on those laurels and then focus on distribution. But you sound like you're continually moving these two together, and to me, that does make a lot of sense, because, it's all about product and improving the product as much as you can. I think that's how Apple does business.
Yeah. There's so many crap products out there. I'm scared to buy anything online. Is this going to be good?
Sure.
T-shirts. I guess I bought some T-shirts a few months ago. Now I So all I see is, t-shirts, but I love to touch them and feel them, but you can't. And so, and I said, well, I'll try another brand, and it's just not the quality. It's just not, what I'm looking for. But one of the things that's happened with us in the FDA, say, once you get registered with the FDA, you're kind of, pigeonholed. That's the formula you've got to use. That's the 4x4 pack you've got to
Got it.
use. That's
Got
your
it.
logo that you've got to use, and you can't deviate from that. Being the fact that we developed this in the early 90s, the FDA kind of took over regulating tobacco in, I think, 2007. So we were grandfathered in. We're one of the very few tobacco grandfathered products out there on the market. But in order to go ahead and become a tobacco product today, you've got to go through that process. And that process can cost as much as $1 million, $1.5 million
Wow.
just to go through the process. And there's no guarantee that the FDA would even accept you. As a matter of fact, they've let very few in the previous administration and the current administration. I think there's been one tobacco product that has been approved under the deeming regulations where they can be a product out there. So
That's interesting.
and
That's
so
interesting.
and there's thousands of applications, but it's just they're just not letting them through, which has been good for us actually.
Yeah.
I don't
Yeah.
really have much competition,
Yeah. That's
so
great.
I'm kind of thankful for that. And that also does affect the way that I operate, I think, compared to the way a lot of people operate. A lot of people are operating their business because everybody's rushing to market. They want to be the number one, the biggest, the best, because competition is so fierce. We've been somewhat fortunate to live in a sheltered globe almost of really not having that happen due to the fact of the FDA's positioning on things. So that's been a benefit.
That is interesting. All right, let's take a minute and talk about the FDA because I think this will be interesting for people to understand, what it's like having to deal with obviously a major government organization. Is that, do you have a point person at the FDA? Do they randomly come visit the facility? What's that relationship like? And then do you manage that relationship or does one of your staff manage that? How does that work?
Yeah, it's interesting. I think everybody's perception of what the FDA does and what they actually do, I think, is a little bit different. But no, it's a process that I manage, and we've got some, good attorneys that actually were former FDA attorneys
Yeah.
or work for the FDA, and so these folks are able to help us down this path. And as a grandfathered product, it's really unique, because there's not a lot of folks in that category. So we do have inspections by the FDA, and our last one we're getting close to our inspection time. It was about a year, 9-10 months ago, and they have a process that they follow. But they look at the quality of the product, they look at the flow of the product. The fact that I developed the infusion process is something that is kind of new to them. They don't know or understand that, but it's kind of neat to hear them talk about like some of the old cigars and how they're made. And even, it was interesting. I said, well, what are the requirements for the FDA in terms of a facility? They said, actually, if you read them, it's like you don't need holes in the roof and water on the ground and bugs anywhere.
Interesting.
They're going back to the old cigar rolling, type rules and regulations. So, but obviously it's a lot more advanced than that. But a lot of it's paperwork, a lot of it's documentation. They're one of the things the FDA is big on in terms of controlling companies like ours is their advertising.
Got it.
You
Yeah.
can't make certain claims. There's certain things you've got to have your warnings on everything that you do. I had some merchandise, a lot of t-shirts, hoodies, things like that. And I didn't have the warning on the clothing, and I didn't realize I had to. And the inspector said, Marcus, you can't sell any of this. And I said, why? He said, you don't have the warning on it. I said, really? He said,
That's
yeah.
interesting. Even on merchandise, like if you have a Zippix hat, you need to have the warning on the hat.
Have to have the warning on the hat. Yeah.
Wow,
Yeah.
that's
I've got like a little zip. I call this my zip box for
yeah,
the old ashtrays, right? Well,
yeah.
you can put your toothpicks in there. Well, we have the warning on the back. We've got little carry tubes that we have. We have the warning on the carry tube. We have like a little
That's
Zippix
interesting. Wow.
airtight. It's got the warning on it. But he did tell me, he said, when you put the warning on there, he said, you're going to sell more merch than you've ever sold before. So, and he's right. People
That's
love that
interesting.
warning.
That's funny. It's almost like you could turn the warning into merch.
Yeah, you could
People will be walking around as a warning. That's
as a
actually pretty
warning.
funny.
Exactly.
That's pretty funny. All right, talk to us about the brand name, man. Where did Zippix come from, and the logo and all that? Because obviously, I know there's a toothpick in the logo, which is very on brand. But talk to us about that.
Yeah, in the beginning, it was nicotine toothpicks. That was we would actually fill all the orders through our pharmacy system. So we never had a name. So at the time when we took it online, we said we've got to come up with a brand. We've got to come up with a name. And it was probably like a lot of things. It was a group of people that I trusted and came together. Actually, my business partner is the one that came up with the name. But zip more, smoke less. We wanted to find something that was a little catchy,
Yeah,
but not too flashy, but we wanted to just get out of the more clinical type look and feel, right? And that was the goal. But Zippix, it stuck. It just stuck.
yeah,
And so we took it out there. And I like the Z's. I like the way it looks. I like the P's. I
yeah,
like the toothpick cutting through there.
yeah.
That's so personal for so many people, right? The colors, the feel, the look.
Absolutely.
And for me, that's probably not my thing. And I was like, me and my wife are in the process of building a home, and I designed everything. But when it comes to the colors and the look and feel, that's her. My brain just doesn't click on there.
Yeah,
But I like it. I like Zippix. It seems to our customers seem to like it, which is
yeah,
good. We
yeah.
there was one I think my wife came up with Goodwood. I'm like, I kind of like that, but you can go a lot of different ways with Goodwood.
You can go a
we,
lot
we're,
of different ways with
we're gonna
Goodwood.
have some T-shirts coming out with Goodwood on them, though. That with the
That's
warning,
funny.
right?
That's funny. Yeah, yeah. Goodwood with the warning. That's hilarious. That's
Yeah,
hilarious. No, I like the Zippix. Plus, you know what? One of the benefits of inventing your own word is obviously you were probably able to get the website, the domain name, and all of that. And it's no different than Google. What the heck was Google? Yahoo, Lyft, Uber, all these brands that really kind of take a word and they turn it into their own. I love that. And I think your coloring and all that's on point. Okay, talk to us a little bit about let's talk about the failures, man, because I think a lot of times when entrepreneurs and successful entrepreneurs like yourself come on, it's all about the successes. And I find that, the audience gets more out of, hey, what were the failures? What didn't work? Was there ever a night where you were up until 2 in the morning and you're like, you know what? Oh my God, I just can't do this anymore.
like in a fetal position, naked in a corner,
Yeah,
crying.
yeah,
Yeah,
exactly.
been there a few times. It's
Chewing on a toothpick.
and from pharmacy, which was corporate America, and being in that level of work for a long time, and then taking the product out and going to the distributors, which did not work for me. And it was just you get a big order out, it's out, then you have to produce another order anticipating your reorder that doesn't come. Your packaging challenges that you would have. If you're at the top shelf and you've got a box with a nice little back folder that says Zippix, nicotine toothpicks on it, and then they move you to the third shelf that box won't fit anymore, and you
Right.
just spent $50,000 on boxes. Well, that's what are you going to do with those boxes? So it's those kinds of challenges. So once retail didn't work, somewhat paused for a while, and this was, gosh, maybe 16 years ago. It's been a while, and maybe 17 years ago, and paused, pursued a couple of other things back into healthcare. And then, but I had customers. So we took care of those customers, but wanted to take it back out again. And at the time I thought boots on the ground, let's hit health festivals. Let's hit women's conferences. Let's hit different venues. And I got into doing some gun shows. One of the main reasons is it was $50 to get into a gun show. It was very inexpensive. But you travel, you come from this corporate level, with the white start shirts to now a t-shirt and a gun show, and in Birmingham, Alabama, and you've made $250, and your hotel and your dinner costs more than that, and that's when it hits hard.
Yeah. Yeah.
I believed in it. I knew this product would, I knew what it did. I knew how
Yeah.
it helped people. And so, which brought me to my best friend. who was actually, when I first got in the pharmacy business, they were my biggest customer, and I wound up going to work for them. I brought that whole respiratory med pharmacy concept to their company. And at the time, they were about a $330 million company. They had about 48 to 50 offices all over the country, and I ran their pharmacy for them. And then was with them for a while, for a number of years, gosh, maybe 15, 16, 17 years. But my boss at the time, Joe Harrelson, who's my business partner now, we just became best buddies. And then we, as everything, we separated and kind of went our different ways. And then back in 18 is whenever we came together to take this product out online. And at the time, as a matter of fact, he said, let's go online. I said, I know nothing about online. I don't know if it'll work. I know that retail wasn't ready for it, for a lot of reasons too, because, the tobacco products are guarded, right? They're behind the counter.
Right,
so
right.
if you don't know it, you're going to look down at the bottom behind the clerk's feet, and that's where we would be. So I knew that wasn't the path for us at the time. So, I had not tried online. And so that's what worked. And we've done that consistency since we've been successful online. We've spent a lot of money to learn what we cannot do. We spent more money learning what doesn't work than what does work. And so, when I have ideas that come to me at any party, there's always somebody that says, hey man, let me tell you, we need to sell these in every restaurant. I mean, well, the restaurants don't have tobacco licenses. The restaurants aren't going to do that, but I always entertain and smile, and like, but it's been a long time of trial and error to see what does and what doesn't work. So,
I think you hit on something, everybody has an idea. Really, everybody has an idea. And fundamentally, every idea you have, probably 50 other people had that same idea. But who's that one guy that is going to take it from idea to execution? And that's rare, but that's what this country is built on. This country is built on entrepreneurs who basically are willing to take that risk like yourself and go from idea to execution. So you're not just a guy at a dinner party, throwing out ideas. You're somebody that actually does it. So I truly commend you on that. Let's talk about where do you think the brand is right now? And where do you think you guys are in the life cycle of a company?
I think that you ask a lot of CEOs about that, and I think me and you even had a conversation about CFOs, and which we don't have.
Right.
I'm in a very happy spot with Zippix. Zippix it's grown up, it's got its legs, and it's running. I feel good about it. Do I want to see it grow more? Do I think it could help a lot more people? I really do. And it really boils down to how much money do you want to spend to get the message out there?
Right.
And, I really respect our margins coming from healthcare, which is the same in the nicotine field. We're constantly challenged with regulation. And regulation is expensive. It's those high dollar DC attorneys that can help combat what may be happening. We sometimes get involved in the vaping nicotine world just because we are a tobacco classified product. And even here in our state, here in Alabama, we've had some new legislation come through that we had to defend. And so, we like the margins. We like to be able to protect what we have, and we work hard and spend a lot to protect that. So from a growth perspective and a spend perspective, it's a balance. We've probably grown, I say probably, I haven't checked it, done the math in probably the last 6 months, but about 120% growth year over year over year. And I like that. I'd like to see it more. But yet on the other hand, you're going to spend more to make that happen. Sure. Do I want to go get investors to make that happen? I really don't. I don't know if it's age. I don't know if it's past experience, but sometimes being still, being consistent, that's been the play the last couple of years, and it's paid off.
Yeah.
Prior to that, if we have successes, we celebrate big. I don't celebrate big anymore. We just, man, that was a good one. Let's just keep going. And that consistency has been a big part of our success. Do we ever sit down and go, hey, let's throw $1 million extra at advertising this year? Let's go out there and let's do Rogan. Let's do this. Let's do that. There was a couple things that have popped up lately. There was a female golfer, and I can't remember her name, and she just signed a big deal with a tobacco company, but she would have been perfect for us. But that would have, that'd cost us about, $250,000 to just do a deal with her, and we didn't. But you look at the return. What we do spend, though, we typically see a return on it.
Yeah.
And my returns are kind of good, because if I go out there, about 40% of the folks that purchase initially will come back and purchase again. And then so our retention is really good. And so I can spend $20,000 on a podcast. I may not make that on that podcast. Some podcasts I do. Some podcasts I'll make my money back in 3 days. But if the ones I don't, I can depend on those reorders. So there's a formula that we study to say, hey, this in podcasting. If I sit here and say, hey, we do podcasts and that's how we do it, and it's that easy, it's not that easy. We really have to study the demographics. We have to study the audience, and then we do some testing on that podcasters in the audience. And even for a podcaster to say, yeah, I'll work with you is not always easy. It's a lot of times because it's a nicotine type product, they don't want to associate themselves with it, even though a lot of times they do come back, and we probably have a very high success rate because they do see the value and benefit that it can offer people. But that's so where do I see us? And now I'm very pleased with where we are. We have really found where we need to be, how we need to advertise, and we're refining that. That's really what I think is going to be, and is consistently my focus, is refining that.
Yeah.
Influencers, really, I'm digging micro influencers. That's a neat piece that it's really right up my alley. You've got a small audience, but we like people that like the product. We did a podcast recently there. I won't say the name of the podcast, but about 1.5 million, followers or viewers through their YouTube, fell completely flat.
Yeah.
But it was a horrible ad. It was a horrible ad read. We now require, if we're going to do a podcast, you've got to have the pouch in your hand. You've got to pull the toothpick out. You don't have to pop it in, but when they do that, it's amazing the results that we see. So we're constantly refining that and refining those micro influencers. That's kind of where I see where we're moving more in that direction. And we do increase that marketing budget every year, to constantly grow, but it also stays in line with our margin. We like to have a healthy margin, which you don't see if you're going through distributors to retailers.
No, absolutely. I think the normal consumer doesn't understand how many pieces of the pie are taken away when you want to try to get to retail, especially the bigger retails, because then they're going to require you to use a distributor. Sometimes those distributors will make you bring on a broker, and then you have to cut off the broker a piece. So listen, I think the direct to consumer business model, especially since now you've seen success in it and you've got that loyalty, that's what it's about. It's about building brand loyalty through your channel. I also like the micro influencer model versus, signing that big name, because what happens when you sign that big name and that big name gets pulled over for a DUI, or that big name gets XYZ going on in their personal life? And I will tell you, I think that consumers now, they're just not as wowed by the celebrity factor anymore. And quite frankly, Zippix is the celebrity. Your brand has become the celebrity. So I think you're moving in the right, you're totally in the right direction with the way you're thinking, the way you're thinking about that as a brand.
It's good to hear.
Yeah, no, I really do. I really do. And, I look at a lot of companies these days and I try to analyze what they're doing. And, anybody that's doing the traditional endorsement model, it just doesn't seem to work these days, because the consumer is more savvy than that. The consumer probably realizes the person endorsing the product is just doing it for the money. And then that's not a benefit to them. So, the micro influencers, now all of a sudden you're talking about somebody that wants to quit smoking. So again, they're using Zippix as their, I liked what you said earlier, step down, that step down method. I think that's great. Let me ask you about this. Talk to us really quick about the concept of the compound pharmacy, because I don't think people understand the different pharmacies that are out there. When you say pharmacy, everybody thinks Rite Aid, CVS, you walk in and you get something. Just help us understand what a compound pharmacy is.
That's where it all began. When pharmacy started, a pharmacist could work directly with a physician. And if that physician needed something, to help that patient, whether it be a single medication or a combination of medications, that physician could work directly with that compounding pharmacy. A lot of most compounding pharmacies would have the support of a supplier that would work with all the base chemicals and can provide them with those base chemicals and provide them with recipes. But what it does is it allows a medical doctor to kind of step outside of the normal pharmaceutical drug manufacturer box. They're going to make a pill that's going to do this. And if you want, for an example, you see a lot of the inhalers, and a lot of the inhalers may be just a bronchodilator. Well, we could actually make a bronchodilator with a steroid and an antibiotic and a mucolytic, to help remove them. You could put all three in one little vial that you would put into your nebulizer cup and then do a breathing treatment. So, and that's why the doctors loved us. They loved the fact that we could do that until, what happened in that industry and why I'm no longer in it is Medicare came in and said, well, we would no longer pay for compounded products, only manufactured products. And so that industry went away. And it's going back to government regulation. It's going back to who controls where's the money flow. And this could be a whole nother podcast that we can really go down some rabbit holes on. But, in a lot of cases, it doesn't necessarily benefit the patient. In my opinion, I use a compounding pharmacy today. Now today, to get my doctor to do something out of the norm is not as easy as it used to be. They're pretty much programmed and they're going down a path that was easier for them, I guess, or safer for them, I guess, or less risk for them, I guess. So compounding pharmacies are kind of a thing of the past. Years ago, a pharmacy would make nicotine lollipops, nicotine lozenge to help people, and then whenever, I think it was Johnson & Johnson who makes the Nicorette product. That kind of shut everything down. They're kind of controlling it all. Nicotine's the most popular drug in the world. And so because it's the most popular drug in the world, there's a lot of control over that product. And not just from the manufacturer's point of view, but even from a government point of view. I used to work with the area health education centers. These are centers it's in every town. If you're pregnant, you'll go there. If you've got a sickness, you'll go there just to get educated on. They also support and run commercials constantly about stop smoking. And I actually they used to buy my caffeine toothpick until they found out that we had the nicotine toothpick. And then that stopped because it was a conflict with them working with Nicorette. And that's the CDC. So you got Nicorette working with the CDC promoting their product. And so then again, that's a whole nother podcast. But
there's so many things that people don't understand in terms of what is needing to take place and, quite frankly, what is taking place behind the scenes. And I think you nailed it where you said it's not always benefiting the patients and it's not always benefiting the consumers, and that definitely is a whole different podcast. All right, last two things before we get into the advice, which is what I really want to ask of you. First of all, on the regulation side, is this a state by state thing? Do you have to get approval, or are there nuances at a state by state level that you have to deal with?
Federally speaking, we're somewhat in a strong position federally as a registered grandfather product. Now, there are state laws, and that's challenging. The law that we just got an amendment added to the bill that had protected us here in the state of Alabama. If we wouldn't have pursued if I wouldn't have pursued the amendment to the bill, it would have prohibited us to even manufacture the product here in the state, only because they're targeting these other nicotine vape products. That's their goal. But when you fall into that, you fall into that, and you have to get the attorneys and lawyers and everybody involved to educate. But it is challenging because I knew that because I'm here in the state. But what's going on in other states, and we do have some sources. We work with. We obviously have to pay tax per state. Some states have excise taxes. We have a company that we work with that really helps provide us with a lot of information on what's going on, or at least they'll give us an indication that, hey, this doesn't happen in this state. You need to find out why. So, and then there's things that like the flavor bans that you've heard with some of the different flavors on some of the vape products.
Right.
That they have in their language, vapes and alternative nicotine products, which that really pulls us in when they have that alternative nicotine product. The government really had made a point to stress that they really wanted to help support, it's called MONA, Modern Oral Nicotine Alternatives, to help support that. But yet nothing's been done. They haven't supported it in any way and created any kind of regulatory channel. But then again, I'm not really complaining because they have literally kept me free of competition. It's a difficult world to dance in, but we've got some good dance partners. In other words, we got some good attorneys. That's why my son is in his last year of law school right now.
Nice. Good, good.
I'm trying to reduce that bill a little bit.
I like that. I like that.
Even though he went in the Coast Guard and he's going to be a maritime attorney, I'm like, what?
Yeah.
I need you over here.
Well, you know what? Let him cut his teeth on that, and then you'll fold him into the mix.
There you go.
He'll be like every other lawyer. When you ask him, what do you do? They're like, I'm a recovering attorney. That's what most of them end up saying. All right, I wanted to ask you about international expansion. Is international expansion on the radar, and how does that work?
Yeah, I once a week I'll get an email from some group, wanting the product, and most of there are a lot of rules and regulations to export nicotine. So we need to know what our role is here in the U.S. to export it, and then we need to know what their rule is for us for them to receive it. We do some work, Australia, Canada, but really every other place we don't. We're primarily just that U.S. direct to consumer. I think that, like anything or anybody, some people are toothpick people and some people are not. Canadians are great toothpick people. I'm an expert on what country is a toothpick country and what country is not. So
That's
just ask me and I'll tell you. Australians love toothpicks. So,
yeah.
But UK, I get a lot of demand from UK just because it's gotten on about smoking and banning everything and vaping. So they see it as an alternative. Even though I don't think the UK would be really, I don't see them walking around with they don't have the cowboy hat and the toothpick, So,
yeah.
And I say that, I do more business
in posh enough for the UK. What country is not a toothpick country? Are there countries that seem to not like that?
I think the Europeans in general, they look at the toothpick as, what is that? What are you doing with a toothpick?
Funny.
That's rude.
That's funny, yeah.
And everybody thinks the biggest bulk of my business would be here in the state of Alabama or an adjacent state. I do more business in LA and New York than I do any place else.
That's
It
interesting.
amazes me.
Yeah.
Shopify is who we go through to process everything. On my phone, I can see how many people are in the website, what town, what state is the most active, and LA is constantly at the top. But if you think about it, if you go to the movies today, if you were to walk up to a movie theater and you see 6 movies, and I do this with my wife, I'll go, honey, out of those 6, those 2 right there, there's somebody with a toothpick in their mouth, None of these, and now that I've said it, you'll probably notice it. It's the tough guy, the bad guy, Hollywood has been using a toothpick as a prop. It's probably their first prop, and it's still a popular prop today. It's part of the culture. I don't know if that's why we're popular in LA, but it could be.
No, that's funny. That is. And you're right. Hollywood has been using, the toothpick as the prop. I think what we need to do is create a campaign where instead of the Marlboro man, it's like, who's the Zippix man? The Zippix man and the Zippix woman. All right. We might have to work on that.
Yeah.
All right, listen, let's end on this because this is the payout. I want your advice for aspiring entrepreneurs, your advice for people listening to this who might have an idea, who might not have an idea, but just people that really want to, live with passion and find a way to balance their work into their life. So quite frankly, work and life become both things that give them joy. What's your advice to aspiring entrepreneurs?
Yeah. Well, you said it. You've got to be passionate about it, and that's one of the first things I ask. And if they answer and they hesitate, and if I can tell they're not passionate, I'll say, take every penny you've spent so far, how much you've got to invest in the future, all your plans and ideas, and put them in a big metal barrel and catch it on fire, because you've got to be passionate about it, Yeah. But I do think the most important thing is to create a good product. You see so many great ideas, this will solve that problem or this will fix that. But if it's got to be just a solid product, because I think our world today is used to getting, my kids, I don't have to buy them Christmas presents anymore. But when I did, all those plastic toys and everything I put together lasted a month, and if you've got something that's solid and you've got something good, that's your foundation.
Yeah.
Then to me, you really got to figure out how to get it out in the world. As a salesman, that's where my career started. That was always the top notch thing. It would, when we the company that I mentioned that I was with my business partner now, I was part of their mergers and acquisitions team, because I would go in there and evaluate, what are they doing? How are they selling? Who are they talking to? Is it really worth spending the money for this business if they're not out there actively connected with their customer base? And so those are the two biggest pieces, really having something that it's good, you believe in it, and a little bit of desperation doesn't hurt either. To be honest with you, when I had Zippix in the pharmacy for decades, and it was just a product that really helped our patients, that was awesome. That was wonderful. But when my world had changed and my career changed, and I did a lot of different consulting in healthcare for a while, but still had the Toothpick. But when I really got it out there, and money was there for rent, money was there for car notes and everything else. When you've got some desperation, you know that you've got to make this happen, especially when you're a little bit older. What else can I do? They're not hiring guys this age. It's a younger world out there. So that putting yourself, what is it? Burn the ships, right? Land and then catch the boat on fire, because there's no other option. And, and that's really where I felt, I've been with Zippix multiple times, creating something from nothing, a brand, especially in the tobacco world that's full of regulations, full of marketing restrictions. I mean, it's been an uphill battle since day one. I don't celebrate, but there's days that I'm screaming happy inside, because I am so pleased today and blessed with the success that we're having at Zippix, and to see the reviews that our customers leave us, and to talk to them on the phone, and to get the emails, it's exciting, it's exciting. But that's it. Create something good, create something solid, stand behind it, be passionate about it, burn the boats, commit completely. It's so easy. And anytime you're an entrepreneur and you're starting a business, or you're in the middle of it, we're going to be doubtful, every day. There's days I'm going, there's no way this is not going to be huge. And then there's the next day, it's like, what the heck was I thinking? This isn't going to work. People take a toothpick and chew on it to get nicotine, we'd get comments back like, I can't get this thing lit. It's like, it's,
That's hilarious.
I get emails where people are saying, man, you've changed my life. I've been smoking for, 20 years, and I haven't smoked in 2 months. I feel better. I'm playing with my grandkids. And then the next email will be from some mom that found a pack of Zippix in some kid's backpack, and will call you every name in the book, not that we sold it to them.
Right.
But, but they got it from somebody and that's how that happens. It's, that's it, burn the ships, be passionate, and make something good. Don't make something crappy.
I love it, man. I love it. And I will say again, I did take time to read through all your reviews, and I can tell you, you've changed people's lives. You absolutely have changed people's lives. There were so many reviews that talked about how they basically have been able to quit smoking and use Zippix in order to get the nicotine that they needed. And quite frankly, there were people that talk about how they just feel better. They've lost weight. They've done all this. And so anyway, I really applaud you for that. And I also appreciate the candor and honesty. Everybody thinks that, actually my brother always said, hey, if it was that easy, everybody would do it. And I really believe that when it comes to being an entrepreneur. If it was that easy, everybody would do it. Why would you not do it? But it's not that easy. And your tenacity, the tension that you have in the system, I feel like that fuels you as well. So anyway, all right, listen, what I'd love to do is I'd love to check back in with you in maybe a few months and kind of see where things are going, see where the brand is, and just kind of take it from there.
I'd love that. Yeah. Yeah, most definitely. And this has been a pleasure. I really, telling the story and putting the story out there. This is the first time that's really happened. And so I'm glad that it's through you, and I'm glad you're able to bring this message out there to folks that will hear it and see it. And if we can help anybody, through this, I'm that it's a win for sure. So,
Well,
yeah.
I appreciate that. That's an honor to be the guy to bring this message. So, all right, listen, everybody. Zippix nicotine toothpicks. You guys take a look at their website, take a look at the product, take a look at the reviews, read the reviews, and we'll put all the information in the show notes. Marcus, stay on the line a minute. All right, everybody. Call a spade a spade. Call your parents. I hope you enjoyed this episode the way I did.
This episode was brought to you by Zippix Nicotine Toothpicks. Zip more, smoke less. Totally satisfying, discreet, and delicious. Zippix nicotine-infused toothpicks are available in 6 great flavors, each containing at least 2 milligrams of nicotine to curb those cravings. Zippix is FDA registered and proudly made in the USA. Use discount code DSD for 10% off your order at zippixtoothpicks.com. Zip more, smoke less, save 10%.